Doing the microcannula to inject Juvederm into Todd's medial cheeks. And our objective in doing this is to help lift up on the nasolabial fold a little bit so that's not quite as obvious. And also to give him back a little bit more fullness in this area. As we all age, our medial cheek fat pad kind of falls downward a little bit, and when it does that, the nasolabial fold right here becomes more prominent. So we're going to be using a blunt tip cannula today. That's different than when we use the needle. And there are a lot of advantages to using a blunt tip cannula. One is there's less pain for the patient. They're not feeling that needle kind of trace through under the skin. The second is there's a lot less bruising. And then the third is it's a very safe technique because instead of using a sharp needle to track over to the area we want to rejuvenate, we're using a very safe blunt tip cannula that cannot get into any arteries of importance. So we're going to go ahead and get started, and we're going to show you the technique of using the blunt tip cannula to inject Juvederm. Is mark the area where we're going to introduce the little introducer needle, which makes our little track mark for our blunt tip cannula. And we're going to do that on the same side, in the same place on both sides. And I just use a little bit of lidocaine, just a drop of lidocaine, so that he doesn't feel the introducer needle going in. So we just pinch the skin, put a little tiny drop in there. And then let me have him turn the other way. We'll do the same thing on this side, just a little drop of lidocaine. Okay. And then the next step is to make a little track mark with the introducer needle. And so we go right into that area that we injected with lidocaine, little stick here. And we just make a little track mark right in the area where we want to go with the blunt tip cannula. And then Dorothy's going to take out the introducer needle, and then I'll be putting the blunt tip cannula in, and this is how it looks on the Juvederm syringe. So I go right into that area that she just removed, and you can see that that little cannula just slips right in there. Kind of pinch the skin a little bit, and there's a little bit of tugging as we get over to the area that we're trying to inject. You doing okay, Todd?
Mm-hmm.
So a little bit more tugging. You can see that that cannula advances all the way over to the nasal margin, and that's right where we want to be injecting because that's where the medial cheek fat pad is. So we make a little tiny fanning motion here to get the Juvederm right where we want it. We don't want to put in too much at any one time, so we're just going to be using a half of a syringe here. And then gently massage just to make sure that we don't get any lumps or bumps later on. And Todd will do the same thing at home. And what we're going to do now is sit Todd up so we can show the difference between the left side and the right side. See, he's got a lot more fullness here than he does over here, which is a little flatter. So we're going to obviously go back now and make both sides even. So we'll put him back. Same technique on the other side.
Yeah, it's not even painful. It's
Good. On the right side, little introducer needle into an already numb area. A little poke here. Doing okay, Todd?
Mm-hmm.
We don't need to go too far with that introducer needle. And then Dorothy takes that out. And we immediately put the blunt tip cannula into that little space. And then we just gently move over, again, same direction as we did before, right into the area that we want to reach, which is the medial cheek fat pad, right abutting the nasal junction right there. And we put just a little bit of the Juvederm in, kind of tracking in a fanning fashion. We want him to have the same nice lift that he got on the left side, over here on the right side. And you'll see when we get done that his nasolabial fold looks a lot less prominent than it did before we started, as well as having a lot more volume in the medial cheek area. And as you'll notice, because of the blunt tip, we're not getting any bruising. He's doing great. And how was the pain, Todd?
Yeah, hardly anything.
Good. So we want to make sure we do a little massage of those areas that we just injected. And let me set him up so you can see the difference here. Take a look at the nasolabial fold. Right along here, and this nice fullness that he has here. Now he'll be a little swollen for the first 36 hours. That swelling will settle down, and he'll have just a real nice volume enhancement right along this area that I think really rejuvenates him nicely. We can use the cannula in any area of the face safely. And when we're rejuvenating the face, oftentimes we'll do the medial cheeks, we'll do the pre-gel sulcus, sometimes in front of the ear, and sometimes the temple. So those are other areas and other applications for the use of the blunt tip cannula.